Shannon, welcome to the Easy Conversations podcast. Thank you for joining me this morning. I'm really excited to have this conversation with you today. There's an aspect of your research that I find very interesting, and I think the listeners will be able to also gather some insight from it. So, before we jump into that discussion, I do want to give you an opportunity to share with the listeners a little bit about yourself and what's the work you're doing and what's brought you here today.
So, thank you so much for having me. I'm really excited to be here too. Yeah, so I guess the most basic information about me is that I am a clinical psychologist. I've been practicing for about 15 years. And in addition to that, I'm also a psychology professor. Really, my main gig is developing and testing new treatments for common mental health conditions like anxiety and depression and borderline personality disorder, and then running clinical trials to make sure that they work, that they help people get better, that they're improving the treatments that we already have. And those two kind of spheres of my work really go together because I'm trying to develop these cutting edge treatments and then I'm providing them directly to patients.
Mhm. Yeah, no, absolutely. And when it comes to anxiety, what are you finding in terms of what's working the best? So there's a lot of modalities out there when it comes to treatment, and it can vary depending on the client's needs or where they're at. But what are you finding the most effective? Because I feel, especially in today's world, we're more prone to anxiety, and I think majority of the times it's self-induced. But what can people do differently? And I know this is probably a broader discussion, but just wanted to get your thoughts around that.
Yeah, that's a great question and a broad question. So I'll do my best.
Hmm.
But yeah, I think that a lot of times when people are faced with anxiety, they think that's a bad thing. So the first thing that I would suggest to people is to remember that anxiety is adaptive, right? That if you're feeling anxious about something, there's probably like some truth to it or some nugget that caused that anxiety to come up, right? And it's your body's way of telling you, hey, like pay attention, prepare for that. That's important. And a lot of times where people run into trouble, where we move from like anxiety as an emotion that we all have to anxiety as a condition that is causing problems for us or getting in the way that we might need to seek help for, is how we respond when that anxiety comes up. And most of the people that I'm seeing in my practice that have generalized anxiety disorder, so they tend to worry or they experience panic attacks or they have OCD, they experience anxiety and they think to themselves, this is terrible. I hate this feeling. What does it mean that I'm feeling this way? This feeling means something bad is definitely going to happen. And they engage in strategies to avoid, right? So if you have social anxiety,
Hmm.
most of us feel anxious if you're giving a presentation or you're meeting new people for the first time. Like that's normal. And what makes it problematic is when we think, oh my gosh, they're going to tell them I'm anxious. This is so bad. No one else reacts like this. And so then they avoid, right? Maybe it looks like they don't even go to the social thing. Maybe they don't take classes with a public speaking component. Maybe they do go, but they're like on their phone the whole time. And so we call this avoidance. And avoidance
Right.
works really well in the short term, right? If you don't go to the party, you don't get anxious, but it backfires in the long term, really
Right.
maintaining the belief that anxiety is dangerous. And that's where I think anxiety becomes more and more common and how it goes from this normal, natural emotion to something that is really interfering. And then on the treatment side, I'm biased because it's my own sort of specialty and where my training is at. But the best evidence for treating anxiety disorders is to use cognitive behavioral therapy. And that makes sense because
Hmm.
the behavioral part is basically avoid avoiding. We encourage people to go into the situations that bring up those emotions so that they can learn, gosh, that emotion, I can actually tolerate it better than I thought I could, and it's temporary, and I have the skills to cope with it. And then the cognitive piece is really evaluating your thoughts about the anxiety itself, about the situations that bring it up. And our treatments for anxiety disorders, cognitive behavioral treatment, they have like an 80% success rate where people within 12 weeks, 12 sessions, no longer meet criteria for anxiety disorders that they've had for years.
Hmm. Yeah, no, and I appreciate you touching on all of that because I did want to bring up that CBT side. But what I'm hearing from you, and this is something I've also covered in the past around performance anxiety, also is there's an optimal level of anxiety. And to your point, some of it is okay. That's just normal. It's part of being a human. It's where you start catastrophizing the situation, and where that's I think that's where the CBT is helpful, where you can actually evaluate your thoughts. And one of the things I've tried to do with clients in the past is write your thoughts down and then evaluate them in terms of how real do you feel these thoughts are, right?
Mhm.
What's the evidence that you have to have those thoughts? What are the pros and the cons? And then the second piece you touched on, a huge component of CBT is that exposure therapy side of it, right? So
Mhm.
exposing yourself slowly to the situation, and then I think that allows you to determine that, okay, this situation isn't as bad as I thought it would turn out to be. And majority of the times it is in our head, right? So I just wanted to tie that together. Now, one of the things you had mentioned to me is in terms of the research you're doing, how CBT also helps people experience personality shifts. Are you
Yeah.
able to give some insight on that and help us understand how that comes to play?
Yes. As a bit of background, my career has really been focused on developing treatments for anxiety, depression, other common mental
Mm-hmm.
health conditions so that they're better. And another piece of that is so that they're more accessible. Right now, when you think about our big book of mental disorders, the DSM, there's hundreds of disorders in that book, and our kind of prevailing way of treating them, particularly with cognitive behavioral therapy, is a different treatment for every disorder. And that's like a real pain in the neck for clinicians because it's too many treatments to learn. So a lot of times therapists rely on what I call the like, how was your week kind of type of therapy that's not structured, that's not building skills,
Mm-hmm.
because it's not feasible to be up to speed on all these different treatments. And another issue with these like kind of diagnosis specific treatments is that most people have more than one disorder. So like comorbidity or co-occurrence of two or more disorders is like the rule, not the exception. And so if you have depression and
Mm-hmm.
anxiety, like which manual do you choose? The anxiety one or the depression one?
Yeah.
And the way I came to be interested in personality as a treatment target instead of like generalized anxiety or depression or social anxiety is because there's really good basic science research that suggests that our personality dimensions, so there's five of them, and I can talk about that in a minute, but our personality
Sure.
dimensions are like an overarching risk factor for different mental health conditions. And so the thinking is, what if we targeted these sort of higher order, these higher order vulnerabilities that put a person at risk for all of these different disorders as a way to make the whole system a lot more efficient? And I've worked on treatments. I'll back up a little bit and say,
Yeah.
a lot of the personality tests that you might take on the internet are like absolute trash and are not really based in any type of evidence. And
Mm-hmm.
there's not a lot of communication between academic psychologists that study personality and these tests that you take on the internet. And so the personality kind of model that is really well validated in academic settings is called the big five or the five factor model of
Mm-hmm.
personality, and it consists of neuroticism. So, how often and how intense are your experiences of negative emotions? Extroversion. And a lot of people think extroversion is like how social you are, but it's actually how
Mm-hmm.
prone you are to like excitability and positivity. And the social piece is just part of that. Conscientiousness.
Mm-hmm.
So, how reliable and organized and achievement striving you are. Agreeableness. So, how well you get along with other people. And then finally, how open you are to new ideas, experiences, aesthetics. And so those
Mm-hmm.
big 5 traits, like, they can explain all the different hundreds of mental disorders that we have in our big book. And again, it's more efficient to target these overarching risk factors than actually the symptoms themselves. And we can,
Mm-hmm. Mm-hmm.
and it works.
Yeah. 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 No, and I appreciate that explanation. So, a couple of questions that come out of that. So, first
Yeah.
one, let's focus on, as you mentioned, these online tests that people can just access. Why are they not reliable and adequate from that perspective? And one of the things that comes to my mind is it's fairly complex and nuanced in terms of how you determine some of those traits for yourself. A
Yeah.
5 minute test online is not going to actually give you a reliable outcome of where you may fall. But what are some of the reasons why these tests are not accurate in that sense?
Yeah, so for 2 reasons. Personality is really it's descriptive, right? So it's basically
Hmm.
when you're filling out any of these tests, right? It's what we call face valid. The questions are asking
Hmm.
exactly what you think they're asking, right? So, do you
Hmm.
enjoy being in crowded places? That's getting at extroversion.
Hmm.
And so when we answer these questions, we're reflecting to the test what we already know about ourselves. And you can measure like these five dimensions of personality with pretty good accuracy. The problems with the more like commercially available tests is that they try to like combine our different scores on the different personality traits into these overarching types or yeah like types, right? So like when I take the Myers-Briggs, for instance, my personality type, I can't remember what the number is, but I it's the label is protagonist. And that's
Hmm.
great. That's great PR, right? Like people love getting, "Oh, you're this type." It like really simplifies something that can't be simplified. And so there haven't been a ton of studies, but the studies that have been done suggest that those personality types, they don't predict future career success. And so most of the time, these tests are being used by
Hmm.
corporations or schools to tell you, oh, this would be an ideal career for you. They're not great at predicting outcomes. The other thing too
Yeah.
is that one kind of myth about personality is that it's static. You're stuck with the traits you're born with and there's no evolution. And that's not true at all. And data suggests that
Hmm.
as we age, we tend to get less neurotic, we tend to become more extroverted, we tend to be more agreeable, more conscientious, and more open. And because personality changes across our lives, it's really hard for your personality right now to predict like how you're going to be doing in the future because it's like a moving target.
Yes.
And so those are the reasons why those tests that we can take on the internet that are readily available, they're not super accurate.
No, I appreciate that. And when it comes to neuroticism, I think one of the things I've been able to at least appreciate and understand is that can often be the more predictive metric within the big five in terms of determining your propensity for some of these disorders we're talking about when it comes to mental health. Is that fair? Or I'm assuming the other ones also play a huge role, but is it typically the neuroticism that really leads the way?
Yeah, so neuroticism is the personality trait that's associated with anxiety, depression, eating
Hmm.
disorders, CD, PTSD. And those are the most common disorders. So if you're really trying to, if you're a therapist and you want to get training and treating one dimension of personality, you'd probably get more bang for your buck there because those are the people that are seeking treatment. That's like the biggest group, like the highest prevalence rates. The other
Hmm.
personality traits are really important. So I in my research, I treat borderline personality disorder. And so neuroticism is a really
Hmm.
important piece of BPD because those folks experience their emotions really strongly. But they also can be really impulsive, right? That's like low conscientiousness. We call it disinhibition. And so if a person is high in disinhibition, a treatment for neuroticism isn't really going to touch that, right? And I use substance use within BPD or just
Hmm.
substance use broadly to illustrate this, right? Some people use substances because it makes them not feel the negative emotions, right? And so that's more of a neuroticism process. Some people use substances because it feels good, right? And that's more of an impulsive, disinhibited
Yeah.
reward responsivity process. And what I think is really cool about targeting personality is that you can get really nuanced with where do your symptoms come from, right? Because knowing someone has a substance use disorder doesn't really tell you why and like how you should treat it. But knowing
Yeah.
that you're using substances because it feels good kind of sends you in a direction of, okay, here's how I would treat that. I would target the disinhibition versus the
Hmm.
neuroticism.
Yeah, absolutely. No, that's fair. And one of the things I feel like doesn't get enough attention, and a lot of the times the focus is on the personality traits. Where does your temperament fall into this? Because we're all born with a specific temperament, and I think that knowing that can help too. But what are your thoughts around that? Because there's not enough conversation around temperament, and some of the research I've come across, I've been able to focus on temperament, and often that can make a big difference too.
Yeah. So it used to be that personality and temperament were really separate areas of research. And temperament was like very like biological basis, like how are people what are the biological reasonings behind why people respond the way that they do or act the way that they do. Whereas personality at historically had been studied more as like what we call like the structural tradition, which is just really trying to map out how people differ with little regard to like why they differ. And more recently, I would say in the past 30 years or so, there's been a lot of research looking at the personality traits and looking at temperament. So, temperament, like, neuroticism can also be considered a temperament, or sometimes you hear it referred to as internalizing or negative emotionality. That Anyway, there's been a lot of research basically showing that your early temperament and how we describe personality are really overlapping, that there's not a big difference between them. And so I think neuroticism, for instance, is the most heritable personality trait. Most it gets passed on the easiest. And but still only 50% of your neuroticism is due to your genes. And so that's like a lot of wiggle room to make changes through your own intentional actions or through selection of
Yeah.
environment.
Yeah, absolutely. But I think as through the development, when you look at a child's development, for example, that environment can have a huge influence. So if I'm looking at it, your brain doesn't fully develop till you're in your mid 20s. That can vary depending on gender. But if I'm a child and I've grown up in an environment where neuroticism is my parents are more prone to it, how do I
Mhm.
then differentiate myself depending on my temperament as I become an adult? What are the things that I can do? First of all, how do I become aware of it? And then what are the things that I can
Yeah.
do to help myself?
Yeah. Those are great questions. The first piece that's worth considering is that the majority of personality change occurs after someone is 20 onward. And I think that's
Mm,
part of the reason. I think the reason is that before we're 18, before we're 20, we don't really have a lot of agency around the environments that we're in. But once we're grown, we do. And so you do. So I think that's an empowering message to people that even though you're coming on this planet with a biological tendency, and then you've been in like a home environment that maybe reinforces that, really pulls that out. Data suggests that what happened in those first 20 years doesn't necessarily have to have a huge impact or an impact forever on you. So that's the first piece.
mm,
The other thing that I'll talk about with neuroticism with people is when I'm in session with folks, I'll say one of the risk factors that we know for developing anxiety, depression, some of the conditions that you come in with is this biological tendency to experience negative emotions. And
mm,
that's not necessarily something that we can totally change per se, right? And it's also not necessarily a bad thing. I'll always tell my clients, I would describe myself as pretty neurotic, pretty emotionally sensitive. And I actually think that makes me a better
yeah.
therapist because it allows me to be more empathetic, right? So being a person that experiences negative emotions
Hmm.
doesn't have to be a bad thing. But the problems come up when, and this is the learned piece, right? When we evaluate those negative emotions as weakness, as problematic, as a sign of danger, as too uncomfortable that we can't stand it, right? That's when we start to engage in behaviors that then, instead of looking like negative emotions, look like mental health conditions. So when I think that I should be able to squash my emotions really quickly because that's the message that I've been getting growing up, maybe I would turn to substances or I would turn to self injury or binge eating, right? Things that are going to squash those emotions really quickly. The problem isn't really the emotion. It's like the message that you got that you should be able to get rid of your emotion and that emotions are bad. And that is 100% something that we can change.
Hmm. Yeah, and I do want to come back to that. First of all, though, I want to talk about the neuroticism piece because I think if an individual were to hear I'm high on the neuroticism side, they may internalize that as a negative thing. But to your point, you can actually change your perspective. And part of CBT is really that reframing around, okay, the awareness is good, absolutely. But then how can I use this to my advantage? And as you shared, maybe you're more empathetic, more compassionate. You are able to experience your emotions better. So, where does that shift need to happen? And is that something that, as therapists, for example, we can do more? Or if someone on the receiving side is aware of that for themselves, can that reframing be powerful in that sense?
Yeah, I think that one of the most common things that we talk about in therapy is like, it's okay to feel, or it makes sense that you're having that reaction because of X, Y, and Z. So we really spend a lot of time rewriting.
Right.
So yeah, really important to reframe what it means to be high in neuroticism. I mean, I think that like I said before, I think when you take these commercially available online tests and it says you're a feeler, right? That sounds a lot nicer than and so I think
Mm.
there's like a little terms of just these labels. Um, emotional sounds better, right? And it's exactly the same thing. And so I do think that it is really important to potentially communicate the positive experiencing emotions. And something that we do a lot in therapy, right? We spend a lot of time talking about, well, like, why do we have anxiety? Why would you be screwed if you didn't have sadness? And then I do
Mhm.
a lot of workout. Well, makes sense you're feeling this way because, kind of fill that in. So like giving themselves compassion for why that they might be feeling a particular
Mhm.
I do think that there have been some generational shifts of like people being emotions. And I think that's a good thing.
Mhm. Yeah, no, I absolutely I appreciate that. And I think we've touched on it in different ways, but coming back to the whole aspect of how can you then experience some of these personality shifts? And maybe we need to expand it beyond neuroticism and focus on all five, because there could be similar changes there. Individuals
Yeah.
can become more open to experiences based
Mhm.
on what they've gone through in life, or become more agreeable from that perspective, or less agreeable, I guess. But but yeah, so what are these shifts that can happen, and how does the modality of therapy play that? What role does that have to do with those shifts?
Yeah, yeah, absolutely. So personality is your characteristic way of thinking, feeling, and behaving. And I think when we unpack the definition of personality, the ability to see it as changeable opens up a little bit more, right? Because we change our perspective on things all the time. We change how we
Mm.
feel about things through our experience, and we develop new habits or behaviors across our lifespans, right? And so if we maintain our those changes to our thinking, feeling, and behaving over time, that's going to mean we're going to fill out those personality questionnaires differently, right? Essentially, you're shaping your personality. And so, where therapy fits is like, okay, thinking, feeling, your CBT triad. And so,
Mhm.
you can imagine how those strategies, those cog strategies, and let's take an example that's not neuroticism, right? So, like, I mean, if you've ever interacted with somebody in a school setting, there's always people that I need the adrenaline of the last minute to get started. Right? Like, no, that's actually like
Yeah.
that's a belief that you have really true. You don't need adrenaline to open a book, my guy. Like, so I think like that's an important place
Yeah.
where you can see those cognitive shifts. And then in terms of behaviors, right? Like when we behave in a way that creates new learning, like actually can start in advance and it's not that painful. Or actually, I can withstand this urge to do something fun right now in the service of my long term goal. Like, I actually can do that. Then that's really important reinforcement. So, I'm always encouraging folks to pay attention to two things: identity. So, like, what are you telling yourself about what you can and can't do based on your personality? And to use some cognitive flexibility there. And then I'm also telling people to pay attention to reinforcers, right? You try new behaviors and see what happens and really pay attention if there is some like positive reward for doing something a little bit different because that's going to
Hmm. Yeah, no, absolutely. So I appreciate that. And one of the things you also touched on, want to make a lot of this more accessible. So, kind of understanding, why do you feel that perhaps today, as it is, it's not accessible? And what are some of the ways you think it can become more accessible? So, work you're doing around creating that, or closing that gap.
Yeah, I think that is on like a couple different levels. So on like
Hmm.
the personality change, I mean, part of the reason that I, have like myself available as a podcast guest is that I've had clients come into session, or I've heard my own friends, not in a therapy context, say things like, I just good at X activity because I'm not Y trait enough. And like, I think the science really supports that at all. And so I hate the idea, especially people who the personality tests are so popular, and like by extension, like zodiac and horoscope, right? Like I see that's like a real like Gen Z kind of thing. And I hate the idea of people making decisions about who they can be or what kind of life they can have based on this snapshot of where you are right now. So that's like
Hmm.
some of what I when I think about accessibility is knowledge and science accessibility. And so I think part of that is in academia, it's believe it or not, it's kind of frowned upon, like hitting Twitter and like, but I'm doing it because I think that it's really important to spread actual.
Yeah.
So that's access there. Um, the other side of this is, like, access for therapy, and that's really, like, my mission when it comes and that's really tough. Um, there will probably be never be enough mental health professionals, trained mental health the demand of people seeking services. So, most community clinics that you go to have really long wait lists, and that, like, people who can afford to pay out of pocket, like, they can get care, but, like, most people that are using their insurance a long time or it's, like, questionable quality, in terms of what people are getting.
Yeah.
And so part of what I'm interested in is, like, with the personality stuff is could we make our system of treatment, like, more streamlined? Like, it's here for clinicians to learn 5 treatments than 100 treatments. So maybe if, like, we make the treatments
Hmm.
easier for therapy, use them. And so people will get better faster.
Yeah.
Another thing I work on in my research that we haven't talked about at all, but it's not really personality related, like science-based decisions for when to enter. So instead of having somebody just like therapy because they just like coming, having
Yeah.
um, better for when, okay, like you're actually going to continue to get better on your own if you keep practicing. So like we're going to boot you so that we'll waitlist in. I think that's really important too. A
Mhm.
more health perspective, I think like prevention, right? Like because a lot of
Yeah.
you don't wake up with an anxiety disorder. It develops because of these patterns of I don't like feeling this way, and then I avoid, and that can be avoided right younger. How to
Mhm.
manage their emotions. I think you're in Canada. Your government probably would be more supportive of
Yes.
prevention. In the United States, we um
Yeah. Well,
teach that. Yeah, I mean, at least you guys have like healthcare. um. Anyway, yeah, so prevention, like being creative around delivery methods and triaging people to the level of care that they need. Like, not everybody needs 4 months of the highest quality therapy. Benefit from just like kind of a supportive ear to kind of figure things out. Some people could fit from online treatment. Some people could benefit from a self help book. And kind of
mhm.
figuring out who those people are at that and directing there. And then really not being I know therapists can be really judgy about, like, just, like, technology or AI, right? Like, "Oh, they're gonna replace me,"
Mhm.
but no, because there's so much demand, so, like, we need to be creative around what that looks like.
Yeah. Yeah, I agree. And I think to your point, it's really knowing what the client's needs are. Because sometimes if an individual is just looking for different ways or different things, maybe a bot or AI driven solutions are probably more feasible for them as opposed to going and working with a therapist. So
Mhm.
there's a couple of things that you touched on I want to come back to. So you talked about the science-based evidence around facilitating an individual's kind of outcomes and to the point where they can then exit therapy. Now, one of the things I've come to realize is you can also reduce the frequency, right? Maybe you don't need to
Yeah.
go once a week, maybe it's once a month or once a year. So,
Yeah,
how do you then determine that through some of the research that you alluded to in the case that you're looking at?
great question, and I don't know that anyone did that.
Mm.
There are people that have, like that have looked at dose and have looked at so actually, like, we're all like 50 minutes a week, once we therapy, but actually, like, you could give the same number of sessions, but do it, instead of 8 weeks, you do of weekly, you do 4 weeks of and people get just as better, but like in a month instead of in 2 months.
Mhm.
So I know there's some research that looks like that. But that we really haven't as a field studied, what is it like to reduce frequency or to like have like ad hoc booster sessions, which I use liberally. Like, you know what? Like you get in touch if you need to come in for like choose fresh. Like that's fine. You're once a client, always a client, basically. And there's not really
Mhm.
any evidence for doing that, but anecdotally, in my private practice, I feel like it's a really nice thing to offer people and helps people be like, "Yes, I can discontinue because I know I
Yeah.
can get in touch if I need to." And I would say maybe a quarter of people do, and most people just kinda go on their way
Mhm. Okay, so then what about, I know you touched on the research, so then what are you focusing on with respect to that in terms of
to
the
termination.
science-based evidence? Yeah.
Yeah, yeah, so, has looked at, like, basically engagement of, the factors that we think maintain symptoms as like an early indicator of response rather than looking at symptom remission as like the end point or the goal. So for instance, like we talked about with anxiety, how the problem with anxiety disorders is this belief that like it's not okay to feel that these emotions are dangerous and avoidance. We have this measure, it's called experiential avoidance, this wrapped up of like, I don't like to do things to avoid feeling, early change on this like sort of, approach to emotions, experiential avoidance, if that predicted continued improvement in any symptoms after it was withdrawn. And we found that, you could actually see like if 15 points or more on our scale of, experiential avoidance, then after termination, they continue was, like, between 14 points or even if it increased a little bit, like, they just maintained to their gains. But if their experiential events increased 7 points, worse after terminating. And so this was a small study pilot. It gives this, like and it points us in the direction of, like, oh, like, this can be an early indicator. Like, we don't have to wait till someone's all the way better because this can be an indicator that they will continue to respond even after we withdraw treatment.
Yeah, and I guess the benefit for the client there is, especially, when you think about affordability of therapy, then if they can avoid going for additional sessions that may not serve the purpose that they're thinking they will serve,
Right.
that's a benefit for the client. And then to your point, from a general perspective, it allows the profession to work with other clients that are perhaps on the wait list. The other thing you touched on with respect to accessibility is not enough trained professionals, and that there's obviously a gap there. And what I've noticed is that gap is filled by often people that are claiming to be experts or coaches. I've talked about this previously on another episode. How, when it comes to licensed professionals, as a client, you have to do your due diligence and be aware of who you're signing up to work with. But at the same
Yeah.
time, you also touched on social media, and that's been a huge red flag from my perspective, where there's a
Yeah.
lot of these so-called experts or professionals, or I wouldn't call them professionals, but they claim to be professionals or coaches, and they picked up a book, perhaps they look more, just it's common knowledge now in terms of what kind of disorders are out there, which is good because us to educate ourselves. But there's I guess where sometimes people have enough information to be dressed. So what are your thoughts around all of that? Because I feel like even as an individual who may be struggling with some type of disorder or experience anxiety from time to time, just being able to call it that and label it, it could be empowering, but it can also have other unintended consequences where you may make the issue worse than it actually is in your head. So I know I've thrown a
Yeah.
few. I just wanted to talk through that.
Yeah. So it sounds like the question is around we. well, I'll just summarize by saying we don't have enough clinicians, like trained clinicians to meet the demand, and that has potentially in kind of not licensed coaches.
Hmm.
And yeah, I mean, I think that that's absolutely true. Given that I have been like dipping a toe in social media, I started in January. And I mean, yes, that is very true. There's lots of coaches. And I feel really so on the one hand,
Hmm.
evidence from the global mental health literature that we train people in like low and middle income countries, people with less than a high school education to provide really good CBT in place no providers. And so it's not
Hmm.
that, like, you necessarily need I think, again, we need to be flexible about how we address these, and that's nothing that you can do as easy like, you can't really train coaches in the United States or from, like, license laws and accreditation, and so, no, like, real legit way for these folks to get training, and that doesn't mean
Yeah.
that they couldn't like, I am without a doubt positive that there are people without a degree that are providing probably better evidence-based than some, licensed counselors, 100%. I think it's like the quality is a little scary. I mean, I really know what to do with that. But yeah, I mean, I feel really mixed about it because I know, I mean, I feel really strongly that there are people out there that are doing a great job and providing a space for folks that maybe aren't able to access care in their region. Um, and
Hmm.
like people that are probably taking people's money and like not helping.
Yeah,
Yeah.
and I guess how do you discern between the two, right? So that's where the challenge may arise for
Yeah.
individuals. So I think what I'm hearing is agree with you. There's definitely people doing great work, but it's how do you find those people and how do you
Yeah.
determine which one's which? So then coming back to the other question I threw at you there was around information, right? So we've
Yeah.
obviously been overloaded with information. We have way more, well, I guess we have a better understanding of what these disorders are, but I often see that as a risk too because just say experiencing and it's on a continuum too, right? But if you're experiencing certain symptoms, just to label yourself as someone who's having that disorder.
Yeah. Right. So I think you're right that there's a lot of information around different diagnoses and gives people the opportunity to self-diagnose. Like, I think that that's happening. Like, I think TikTok is a really just like place where it's happening, where people are like, "Oh, this is my," and it's stuff that is not the symptoms of ADHD. um, so like, I think there can be a lot of misinformation. Like, they're just like social media influencers. Um, yeah, some of that is like educate vet a therapist. Um, so whenever I've thought about this a lot because whenever people are participating in my clinical trials, if a T in the past 5 years they're ineligible to participate, have like a number of questions we ask people. So like because often people don't know what they got. So like, did you talk about the thoughts that you were and ask yourself to like come up with evidence? Did you have homework where you were supposed to face things that were uncomfortable to you? Were there worksheets? Was read right? So I always think about how, like, if you're watching, I've been watching the Olympics, and there's been all these commercials for like, pharmaceutical companies that are like, ask your doctor about
Yeah.
X, Y, and Z. And I think that we could again use like a publicist that's like, how to how to tell if your therapist is not providing the gold standard care. Can walk into, like a physician and be like, oh, this is the gold standard treatment for this, but like I don't think that there is I think there's still a lot of myths around what mental health treatment is. Oh, lie on the couch or just take medicine. You provide medicine, right? No, I don't. No, I do not. And so I think
Yeah.
like public education
Yeah.
around what is good therapy could go really far.
Yeah. And I agree. Can't even determine the difference between a psychologist or a psychiatrist. Often people get the two mixed together, and that's where a lot of confusion arises too. Uh, One of the last pieces of, I guess, information or question I had around when we were talking about the personality traits, and this is something you and I chatted about offline too. there's an aspect of intelligence that often gets overlooked too. I just wanted to get your thoughts on that with respect to just how does intelligence fall into that personality trait model, and yeah, how do people account for it and become aware of it as well? Because I feel like that's often missing in that
Yeah.
realm. And it's not that I'm saying that one is important over the other, but it's just important to understand the difference in how.
Yeah, yeah, absolutely, and when we think about, they don't include intelligence. It's not necessarily part of a per module, but someone's intelligence, their functioning, right? Like that's gonna also be really important for treatment decisions, right? So if you know somebody's five-factor model or big five profile, you could say, like, we need to use the neuroticism and the disinhibition module on you. But I think knowing someone's intelligence or like their school-mindedness, right? Like, that is gonna affect how you content, and I think that that's it. Most of the treatments that are developed, these space treatment protocols, CBT protocols, they've been written by, PhD clinical psychologists that are, like, not even necessarily therapists. They're, like, academic researchers that, like, their main form of communication is academic articles that 5
Yeah.
other people in their field read. There's really a lot of work to be done on, like, making me more accessible.
Yeah.
So we've done studies where we have, done trials in our academic, clinic and fine with our treatments. And then we've also done studies where we have, like, taken a 140-page manual and, like, condensed it to 20 pages, double spaced, and simplified our forms. Well, don't have as much access to education, and people can still benefit from these CBT techniques. It's, like, not the patient's fault, and it's not the CBT, it's, like, the provider or the those treatment developers' fault if people are, like, coming to the treatment from.
Hmm. Hmm. Yeah. Yeah. And I think one of the things I've also come to appreciate with respect, and we touched on the personality traits, that they're not as static as we've believed them to be, and or at least what we've understood. But that's a bit more static. And so then people need to be aware of, I suppose. But that's another thing I wanted to bring up with you.
Yeah, I mean, I think that's true, right? That, like, people, right, we can shift our personality. Our IQ is not necessarily as movable. There's also a difference between, like, your IQ, like, your kind of, like, ability ceiling and people are
Mhm.
able to figure out workarounds to be able to do, need to do to live a really fulfilling
Mhm.
life, right? And you can be happy and healthy and, there's really no necessarily
Yeah.
personality traits and IQ.
Mhm.
So, really smart people can be really nice,
Yeah.
and so can people that might be lower on that spectrum, right? And so it doesn't really see, like, society, we're sort of valuing, like, intelligence, but, like,
Right.
I mean, I think the individual goal is just to be healthy, happy, and productive, and
Yeah, absolutely. And I think that intelligence isn't everything. And I think Daniel Goleman did a great job in his book, which is obviously a lot older. And we're t- beyond the intelligence side, focusing on the EQ as well is important. And to your point, yeah, you can go outside of that and still find a sense of fulfillment and contentment within your life. So it's the end all and be all. So I do appreciate that. But yeah, Shannon, thank you so much for this conversation. I really enjoyed it. Lots of learnings for me, and I hope the listeners get a lot out of this, a lot of insight and wisdom you shared with us today. But for listeners that want to find your work or even get a hold, have any questions, what are some ways they can do that?
yeah, yeah. So probably the most direct way is through my website. It is www.personality hyphen, and their my email is there. Access to me, like, in treat, like, coaching and therapy, is there, and then an option that has all of the worksheets and skills that we use for personality change in our clinical trials. Those are free downloads. So that, and then I'm also on all the social medias, like I said.
Yeah.
So mostly on at self.made personality, and on Twitter at, I don't know how you cite LinkedIn.
No, I'll put all of that in the show notes, and that way
Perfect.
people can find it also. Thank you so much again. This was a
Sure.
great discussion.